I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. I'm bringing to you once again some of the insights that you might really need right now. Because here's the challenge that I see, and I keep on repeating myself on every podcast, but I think it's really relevant and important for people to understand that with so much information out there, with so many resources, so many incredible individuals out there that are healers, that there's no longer an excuse to be sick. But the challenge is that, who do we trust? What's that believable resource, source, if you will, person, product, whatever that is. And so that can be the challenge. And then sometimes what happens, you end up spending tons of money on things that actually just do nothing for you. And that's why I call it about this advanced tech and expensive tech. And I'm confused tech because it doesn't do anything for you. And so, whilst many of these podcasts, and brilliant podcasts out there, by the way, that actually are promoting products and hyper promoting people, we don't do any of that. We may suggest some things, obviously, because I think it's all about, giving you the resources. But more importantly, it's about sharing with you the process by which you can make better decisions for yourself when it comes to your health. And what do I really mean by that? Well, like all inventions out there, I mean, they're all different, many of them just incredible, but the process is the same. It's the scientific process to, deliver results. Same thing with your decision making for your health. And so how do we do that for you? Well, I don't know you personally, but I can share with you the process by which many other people make those decisions, and we do that through role playing. So one person will present with a particular problem, whether it's a personal problem or some problem that they know from somewhere else, and then the other will guide them to some form of resolution. See, we all need guides in our lives today that are trustworthy and can help us decipher the complexity of everything that's out there. And this is what you'll see today with both Gary and Charity. So we're going to do that for about 6 minutes. And so it's not a lot of time to get a full resolution, but you might be surprised what's going to come through. And all of this is organic. So I have no idea what Gary's going to present with today. And that's the fun thing. So you might be able to see yourself in that experience. And so that gives you hope. That gives you, clarity that, yes, I'm not alone in this. And there are other people that have this problem, and other people have gotten results. And so can I. So if they can do it, I can do it. And I know, Gary, you've heard that before. So,
Somewhere.
yep. And to give credit to Sean Callaghy, Unblinded, somebody that's very much influenced what I do today, and very gracefully and gracious and grateful for Gary for introducing me to Sean Callaghy and allowing me to accelerate this process by which I can help so many people in the world to optimize their health. So thank you for that, Gary, and thank you, Sean. But let's
Thank
dive
you.
in. So I'm going to have Gary and Charity introduce themselves. Then we'll do that 6-minute role play. And then after that, we'll unpack it for 10 or 15 minutes where you'll be able to get some very specific insights, distinctions, and action steps that you can take for yourself. So once again, Gary and Charity, thank you for joining. Gary, brief introduction of yourself, and then with Charity, and then we'll start the role play.
My name is Gary Ailes, and I retired from veterinary practice after 50 years and thoroughly enjoyed what I did. And now things have changed a little bit because I work in the environment, saving landfills and changing the face of agriculture.
Excellent. Thank you, Gary. And to be truthful, Gary being such a humble kind of guy, the guy is brilliant, a genius in so many ways, but also looking to change our environment in such an incredibly positive way. And I'll have him share some of that at the end of the show. Charity.
Hello, I'm Charity Dale, and I have been working with many women in our community for the last 15 years. The last year, I've been going to massage therapy school because I feel like it's the last way I can incorporate all of my tools that I've learned through healing throughout these last several years, especially. And I think we're all kind of built from broken. And because of that space and capacity, I'm wanting and willing and ready to help encourage so many other people like me that have gone from the bottom and climbed their way through the top through health and body issues.
I love that. And I think many of us can relate to that, coming from a lot of pain and hurt and challenges in our lives, and then ascending through that but again, with people like yourself giving us hope and direction as well. Thank you for that, Charity. All
You're
right,
welcome.
Gary, so you have a problem and Charity will help you, will guide you to a resolution.
So I've had a couple of massages and never really felt like, other than I felt good afterwards, that it was that big a deal. And I've known Charity for some time, knew she had gone to school, and I said, you know, I'd love to have one of your massages. And when I went in, I didn't expect anything more than a really nice massage. And she asked if I had any particular aches and pains. And about 4 to 6 weeks before, I had jammed my shoulder, getting knocked over by a wave back in New Jersey. And it was still hurting pretty good. I could carry things, I could lift, but wasn't right. And I didn't expect anything. I'm getting a massage. I'm not going to have my shoulder worked on. So, Charity, would you like to tell what you did? Because I still don't know, and maybe you can't explain all of it. And I'll tell you about the way I felt the next day after she's done.
Go ahead.
All right. So in my practice, I incorporate a lot more than just the hands-on. So I do work with so many other techniques, cranial sacral, also Reiki, and then in addition to that, the full format of massage. So I always start by meditation, where I really want and ask to become part of that body. And we are all fluid, and it's really being a part of that fluid body. It's an ebb and flow. And with every ebb and flow and touch, I'm able to, through range of motion, stretching, I feel like with Gary, especially when he was talking to me about his shoulder, like I literally could see the impact. So it was from the AC joint into the clavicle and then down his scapula. So I instinctually knew, and of course through training, that we're going to have to really work on his lower back, the QL area down low towards the sacrum, because oddly enough, not many people realize that we are built just like a skyscraper. And a lot of times we hold, if we're injured on top, more than likely it's somewhere near the base of our spine where a lot of that impact actually really happened because of jolt movement. And those are all connected. So I really did start through effleurage, petrissage, and then I worked through the range of motion aspect, and it did keep telling me to climb down to his lower back, and that's where I really felt a lot of his problem was actually in his gluteus medius. And then it's just creating that pathway and making space for everything to kind of work its way back in. I did a nice scapula pull in his rhomboids, settled easily, which released that levator scapula, and then into his shoulder, where I want to say after about a 35-minute session of repetition, top to bottom lengthening, and then I think we did some cupping on that session as well, which lifts that muscle up and everything kind of slides back into its place. So it was a wonderful experience, and that's exactly where my heart is to actually fix people. I mean, we don't know if that's good business or not, but my heart is I really would love to not see someone back in 2 weeks. I really want to heal them. So when they do leave, they don't have to call me up in a week and say, oh man, I am so sore again. I can barely walk. I want them to call me after a week and say, wow, what did you do to me? I feel absolutely incredible still. So.
Gary?
So following up on that, I still didn't expect much as far as my shoulder was concerned. And I didn't notice a real drop in pain at the time. And I got up the next day and I was shocked because I was somewhere between 80 and 90% better.
Mm-hmm.
And it continued to heal over time. And I since had another massage and we worked on a couple other things. And each time I keep getting surprised about how much better I feel the next day, because I've done a partial tear on a medial meniscus in my good knee, the one that's not fake anymore. And I didn't expect anything. And I swear what she did was put clothespins on my knee, because that's what it felt like. But the next day, it felt so much better. Now, I'm not
Mhm.
healed. I still know that that tear is there because I can feel it move, but it feels so much better. And simple manipulation from the outside, I would never have guessed would have made a difference for me the way that did.
Mhm.
So that's my story, and I'm sticking to it.
Normally I don't jump in right now during the role play, but let me ask you this question then. As you're receiving the massage, what were you noticing? What that was different from other massages?
Um, there was a different relaxation. It wasn't just working muscles. And I think the way it seems like charity works, and I've done Reiki before, so I have some understanding of energy transfer. And I think that energy transfer makes such a huge difference with everything that she does, in the way that she works the body, top, bottom, and front, back, that I ended up just feeling like everything was better by the time it was done. But what amazed me the most is I didn't feel the very best right after the massage, but I felt the very best the next day when I woke up. And that's, to me, that was amazing because I've never felt that sort of thing before. And that's one of the reasons I really wanted to have a chance to have Charity come on and talk about what she does, because it's almost mystical. And I think it's very hard to explain it, particularly to people that are allopaths and study science from what we typically do. And I know that when I was practicing veterinary medicine, there was more than one time when I had dogs with back issues and I couldn't find herniated discs or anything that was serious. And I had a friend who was a chiropractor come in, check them, manipulate them, and they'd walk out normal. So I know that there's so much more that we can do besides pills and surgery. And those are things that I'd really like to move more and more into the holistic area. And I think that's what we're headed towards.
Yeah.
No, indeed. And Charity, again, like I said, I don't normally jump in here. And give a final response to your experience with Gary, and then we're going to unpack that all. So anything you want to add with in particular with your experience with Gary that you had?
I work with sound healing as well, so I incorporate that into spaces of my session. And when I was working with him on this last session, it just was incredibly peaceful. I felt like I cleared a lot of um, stuff that was sticking to, I would say, around his belly button area and into the heart. And so working with Gary is so beautiful because it's like we connect on such a different spiritual level, and because we're two bodies working for the same space, which is genuine healing. And for me, it's an honor to have someone like him be on my table so I can help him. So I feel like, I mean, he's just been such a beautiful soul in all of our lives and everybody that knows him. So
And I would have to agree with that.
yeah.
Well, great. Well, thank you for that. And like I said, for my listeners, this is a little different than we normally do, only because Gary had some beautiful things to say about this. And so normally it's a full role play, but today I thought this was worthwhile. I want to give a little context here, and then I want to give it to Charity mainly to share more about what she does and, also with Gary's thoughts. But there is this concept called tensegrity. And so you're absolutely right, Charity. It is like we are a tall building, if you will.
Mhm.
And tensegrity means is that with all the muscles and the tendons and the ligaments, the body is kept in a very tight balance. And so every
Mhm.
part, even your skull and what we call the fascia. These are different sort of what I would call ligamentous plates, if you will, for the listener. Try to stay away from medical terminology, but essentially every part from the skull down to your little toe is connected through tension. And when there is an imbalance in one particular area because of an injury, let's say Gary is someone who sits down a lot and therefore his gluteus maximus isn't being worked out. And so that upsets that imbalance such that when he gets an impact somewhere else, it causes a problem. And so that's exactly what Charity is talking about, but on a whole different level, which for most people is just all very much woo-woo. And for many of those that are practicing it, it is also woo-woo. But the reality is the work that Charity does is real. And it's also based on science. It's based on energy transfer. We, with our 70 trillion cells, our memories are held holographically in every single cell of our body. In fact, it's even more granular than that. And the way that molecules are configured, there is this possibility of keeping memories in this, but that's getting too granular for the show. But what's important is that all of our cells, every part is communicating at the speed of light through energy transfer, informational transfer, if you will, not just hormones, not just nerves. And so we have the capacity, or amazing people like Charity have this capacity to read into this on pretty much on probably an unconscious level and modulate and help with healing. And so this is real stuff. It's all measured in science. And so whatever Charity is going to share next, just think of it this way. It's all energy, it's all vibration, it's all frequency, and it will impact your health, because oftentimes disease is due to an imbalance in your energy flow, your vibrational flow, your frequency. So people like Charity can correct that for us. So I'm going to give the mic to both of you. Whoever wants to go first, go ahead, share for the next 10 minutes so that people get some kind of insight and distinction and action step that they can take.
Charity, you start.
Well, I think I would like to talk about a few things following up on the energy transfer and things that of the mind that I don't really think about. And I believe what Bart was speaking of is sometimes I don't even know if I can do something. I don't even try, don't even act like it's not scripted. None of it is scripted what I do. And sometimes I will have people come in, and my instructor has told me that in my practice, I do need to get a disclosure set up to where it states, because I am a medical empath and I do pull even medical things out of people just from touch or even evaluating a lot of their energy. Even my instructor, he thought he heard his SI joint and the back of his right leg was completely black and blue. And I looked at him and I said, John, you need to go to the doctor right now. You need to get blood work done. I was like, my insides were just panicking, screaming. And he did what most of us do and just, no, it's okay. It just hurts. I'm going to stretch it out. Well, about 2 weeks later, they found a huge malignant tumor on the back of his leg. And so they had to remove all of it. But it's just been my whole entire life. I could see so many things. I can start off with my mom when she had cancer. I literally could see her growth on her rib cage. I could draw the shape. And then when we went into her oncologist and they did her scans, it was literally the exact same shape of her tumor that was on the scan. So I don't know how I can do it. I just know that I'm open to it. And I know that when you put your heart and everything you have into the space and giving, and it is about giving and truly healing, it's amazing what you can get back. And I feel like I'm so excited for my journey through all of this, because I genuinely want to help every individual learn these tools to heal and not know that they always have to go back to the doctor for the next prescription. I mean, I'm built from broken. Like I've said before, I had 2 complete reconstructive hand surgeries. They told me 5 years ago that I could go on disability and that I would never have to work again. And guess what I'm doing? I am a massage therapist, and I am working on everybody's bodies and helping them heal. So when you have 3 or 4 doctors tell you that you cannot, well, guess what? Guess what I'm doing? So never listen to that. And I would love to share my experience with sound healing, like I said with Gary. My experience with sound healing was when I was 16, I drowned, and it didn't come to until I felt, well, I'll explain. We were river rafting on the Columbia River, and my inner tube flipped over and my head got stuck between a rock. And I felt like my memory of it is I was above watching my mom swim, 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 and I felt her fingernails dig into my scalp. And she pulled me out, and she would always say, "Thank God you have red hair," because that's the only thing that I could see. So as I came to, it was like this space where I flew right back into my body. And so my first experience with sound healing, it was 432 megahertz, and it was the root chakra. So I think that's the C note. And I went to this space. It was almost like right before where you go to sleep. And I didn't know at the time, but everything that I was seeing, it didn't come to me until the next day. I saw water, I saw blue skies, and I saw trees. Well, I had forgotten about my experience at that moment when I had drowned, and then it came to me just like a big slap in the face. And I feel like that moment finally cleared all that trauma that I've been holding on for the last 30 years. 30 years of trauma over water, it cleared. And so my biggest passion now is to help so many individuals heal. My daughter-in-law has schizophrenia, and I'm raising my granddaughter. And I'm doing everything I can do to learn how to work with the mind because of the potential of her future, because it's such a dominant gene on her mother's side with the females. And after I've learned actually what sound healing does and how it slows down your brain on a molecular level, and it brings it into that parasympathetic space, so it actually heals. So the whole entire 5, 6, 7 minutes that I have sound healing going on, your brain is actually slowing down and healing. So I'm just really super excited about all the learning and where I can give my heart and healing hands to everybody.
No, I love all that. And this is very real, listeners. You know, whether you have a genetic makeup or predisposition to a certain condition, there's so many other factors that can trigger it or it can mitigate it. And so clearly sound therapy, vibrational therapy is one of those factors that can mitigate it, as well as many others. And so, a genetic predisposition doesn't mean it's your genetic destiny. So thank you for that share.
Right.
Gary, did you want to add anything else?
A couple of things. One, I think that Charity forgets to mention she's also an incredible waitress. There it is. She's also a chef in her own right, and does some amazing work with that. And I hope we don't lose her there completely to the massage, but at the other side, the people that need help, I think it's better for her to be doing this than that. I'm just thankful for having this opportunity. And for the people that wonder about energy, I'm going to suggest that they pick up a book called Whole Brain Living. And it's written by Jill Bolt Taylor, who's a PhD and a neuroanatomist and neuropsychologist who had a stroke. And listening to her describe what happened as the analytical portion of her brain shut down step by step, and she leaned back against the wall and she couldn't tell her body from the ball because all she could see was energy. And you'll have to read the book to get an idea what is or isn't real, or better yet, get it on Audible because the description's amazing. And that goes back to what Charity is doing with energy. and her ability as an empath to see what's going on, feel what's going on, and heal. And I think that's an easy way for people to understand that you've got somebody who's a scientist who's been studying all their life. And her comment was, "This is amazing. I've done all this work in neuroanatomy and neurophysiology, and now I get to study the brain from the inside out on me."
Mhm.
No, I love that. And truth be told is this, in being trained in conventional medicine for 17 years and then being in practice as a plastic and reconstructive surgeon, there's a lot of what I like to put, magic in the training that we get. There's a lot of truth and benefit in all that training that we get, but there's more. And I think that's what we all need to remember is that whenever it's relevant in an emergency or crisis, conventional medicine is perfect, saving people's lives. But the body is so much more complex. And the fault lies with Newton, basically, because his focus has been on materialism, determinism, and reductionism. And the practice of medicine has really focused on reducing the elements to the smallest parts in the hopes that we can control them. But then, of course, quantum physics came in that changed everything. And we're working in the realm of quantum that we don't necessarily understand. But when we can experience it, just like you both shared, then that's when it becomes very, very relevant. And so, once again, a term that you're familiar with, Gary, is the loving pursuit of the relevant truth. And this is true. There are a lot of people out there that, are not coming from integrity. And so it's essential for everyone to understand if this person is real, is this person coming from integrity? But there's so much truth in all of this. And a little disclaimer here, here's my little magician, wizard, if you like. He's a Maine Coon cat, 7 months old. Dad is 40 pounds, mom is 30 pounds, and he gets to be wherever he wants to be during this podcast. I don't interrupt him. So if anybody's bothered by that, hopefully he brought you some magic anyhow. So we're gonna wrap it up here. And the name of my cat is called Marshmallow, or maybe Snowmellow, and he's definitely a wizard. I have two other Maine Coon cats. One's the Royal, he's the king, and then the other is the Warrior, and we're still missing the Lover. The Lover's coming sometime later this year. So I'd like to wrap it up. First with Gary, just once again, how do people find you? Any final comments, anything you want to share? Then we'll go with Charity.
With what I'm doing now, you can find me at ecospheresciences.com, and it's ecospheresciences.com. I hide out on Facebook a little bit, but primarily LinkedIn, and busier than a bed bug with Unblinded. It's loving life as it is, and since I'll be 77 shortly, life is good.
And I want to appreciate you for introducing me to Sean Callaghan and Blinded. He is quite a pioneer in the field of personal development, if you will. That's saying it very, very loosely. I'm not so sure he likes that term so much, but it's really a matter of a heart of influence and, impacting the world on a great way and causing leaders to become leaders. And so love what he's doing, and I'm eternally grateful and therefore honored to have you on the show, Gary, because you've allowed me to accelerate everything that I'm doing in a magnificent way. So thank you for that. Charity.
Thank you so much for having me. It's been a pleasure. My name is Charity Dale, and of course, you can reach me at juniper.healingarts@gmail.com. And I look forward to hearing from anybody who has any questions or is looking toward healing in their own mind, even when it becomes sometimes unbearable. Just please don't feel like you can't reach out to someone, because so many people are just like you and are going through exactly what you're going through. So thank you.
Yeah, thank you for those words, because so many people are lost, they're confused, they don't know what to do. And then they resort to all sorts of practices that don't support them. And there's a lot of reasons for that. And that's why I do trigger people when I say, you know, there's no longer an excuse to be sick. It's not a criticism, but it's a reality, because with people like yourself, with the information, with the technology, with the access and the affordability, it's all possible. And that is why we have this podcast. It's the Doctor's Guide podcast, essentially curating, educating, and guiding you to make better choices for yourself, reaching out to the right people that will support you, knowing that there's possible, you know, even there's a charity, not even though you can't go to charity wherever she's at, definitely there's other charities out there. And it's your discernment, your ability to make intelligent decisions and discern if this is the right thing for you. You know, that's up to you. That's the purpose of the show. And this purpose, then the other purpose of the show is really to have the conversations that you normally would not get, because that's where a lot of magic does happen. You know, once again, being a conventional medically trained doctor, I see hope and opportunity everywhere. And it's a matter of checking it out, trying it out, experimenting in it till you get the results. So once again, Gary and Charity, thank you so much. My name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, and a little raw and unfiltered today with my sweet little cat, Snowmellow, Marshmallow. It varies. He's white. He's my wizard. We'll be back.